Hi, my name is Racer Front. I'm a student of physical therapy at the University of Central Florida. And today I'm just going to give a quick demonstration on lumbar traction. So traction is a mechanical force applied to the body in a way that separates joint surfaces and elongates surrounding soft tissue. And today our patient is going to be a 50-year-old male with L4 nerve root impingement due to decreased intervertebral space from age-related spinal stenosis. And the patient complains of pain and paresthesia along the L4 nerve distribution. So some of our goals and benefits today are going to be to distract the joint surfaces to temporarily increase the space of the intervertebral foramen, and this is going to decrease compression of the spinal nerve roots and decrease the pain, paresthesia, and radicular symptoms. So some of our contraindications for traction are going to be where motion is contraindicated, acute injury or inflammation, joint hypermobility or instability, peripheralization of symptoms of traction, and uncontrolled hypertension. And some of our precautions are going to be structural disease or conditions that affect the spine, and some of these are tumor, infection, RA, osteoporosis, or prolonged systemic use of steroids. And another precaution is going to be where pressure belts may be hazardous, and this can be from pregnancy, hiatal hernia, osteoporosis, or vascular compromise, displaced annular fragment, medial disc protrusion, severe pain that fully resolves with traction, claustrophobia, inability to tolerate supine or prone positions, and disorientation. Now we're going to begin the traction setup for our patient with bilateral nerve root impingement. So the impingement is going to be at the L4, L5 vertebrae, so we're going to position the patient supine on the table with a break in between those two vertebrae. So first what I'm going to do is set up these two upper and lower straps. So I want the straps snug but not tight, and the first strap is going to be around the rib cage. So is that okay? Not too tight? Alright. So the lower strap is going to be in between the iliac crest, so I can palpate that to make sure I'm at the right place. So again, I want these straps to be snug but not too tight. Is that okay?
Yeah.
Alright. Now I'm going to loop this belt through. I want to make sure this ring is at the center so I can get an equal force pull on the vertebrae. Alright, so I'm going to tighten that down. Make sure it's centered. Now I'm going to run this clip through the bottom of the ring. Alright, and I'm going to have my patient's knees in flexion, and what this is going to do is going to target the posterior structures and open up that intervertebral foramen. Okay. So now I'm just going to get my rope, clip it to this O-ring, press it again, take up the slack on the rope, and now we're ready to begin traction. Alright, so we're going to set up the parameters for our lumbar traction, but first what I want to do is I want to unlock the table, make sure we get that clean break in between the L4 and L5 vertebrae to provide some distraction. I'm just going to hand my patient the emergency stop button, so here you go. I want you to press that if you have an increase in pain or an increase in symptoms bilaterally. Alright, so now I'm just going to head over to this machine. I'm going to select lumbar traction. I'm going to enter the patient's body weight. It's 160 pounds. For lumbar, we're going to do 50% of the patient's body weight. And lumbar traction should begin from 35 to 40 pounds, so we're going to do 25% of his total body weight for the minimal level. And we're going to edit the hold times. So for intermittent, it's going to be a 15 hold followed by a 15-minute relax. I'm sorry, seconds. 15 seconds on, 15 seconds off. And then we're going to have a total treatment time of 20 minutes. And right here it says intermittent traction. So okay. So after beginning the traction, I'm going to monitor my patient carefully for the first 5 minutes of treatment, and this is just to ensure that the patient doesn't suffer any adverse symptoms from traction. And the expected outcomes of the traction should be to decrease the signs and symptoms associated with nerve root impingement, and that's going to be by distracting the joint surfaces to increase the size of the intervertebral foramen, which reduces compression on the nerve root.